The disease that attacks your own body, lupus. What if your body couldn't recognize you anymore? Let me tell you something that confuses a lot of people. Imagine waking up one day and your body starts fighting itself. Not an infection, not a virus. This is lupus. And the scary part, it doesn't look the same in everyone. Let's make this real. You start feeling tired. Not normal tired, deep, draining fatigue that sleep doesn't fix. Then your joints begin to hurt. Your skin reacts to sunlight. You develop rashes, sometimes across your face, shaped like a butterfly. At first, you think, maybe I'm just stressed. Maybe I didn't rest well. But it keeps coming back. Because lupus is an autoimmune disease. That means your immune system, your body's defense, gets confused. And starts attacking your own tissues, skin, joints, kidneys, blood cells, even your brain. And here's what makes it emotionally heavy. Some days, you look fine. But inside, your body is at war. That's why many people with lupus struggle to be understood. Because it's invisible, until it's severe. And it comes in flares. You can feel okay today. Then suddenly, everything worsens. Pain, fatigue, fever. Now let's talk about something important. Lupus is more common in women, especially young women. And early diagnosis changes everything. Because untreated lupus can damage vital organs. But when managed early, you can live a full life. The key is listening to your body. Not dismissing unusual symptoms. Not normalizing constant fatigue and pain. Test tube tests to detect. ANA, anti-nuclear antibody test, anti-dsDNA. CBC, urinalysis, for kidney involvement, shield prevention, management. Avoid excessive sun exposure, manage stress, regular medical follow-up, early treatment during flares. If your body feels like it's fighting you, don't ignore it. Follow the lab plug. The pain women are told to ignore, endometriosis. They told you it's just period pain, but it's not. Let's have an honest conversation. Because this one affects a lot of women, and is often ignored. You get your period, and the pain is intense. Not just discomfort. We're talking about pain that stops you from moving, makes you miss school or work, leaves you curled up in bed. And when you complain, people say, it's normal. Periods are painful, but what if it's not normal? This could be endometriosis. Here's what's happening inside your body. The tissue that normally lines your uterus starts growing outside of it. Yes, outside. On your ovaries, on your fallopian tubes, even on other organs. And during your menstrual cycle, that tissue still reacts. It thickens, breaks down, but it has nowhere to go. So it causes severe pain, inflammation, scar tissue, and over time, it can affect fertility. Now here's the painful truth, not just physically, but emotionally. Many women go years without diagnosis. They're told, you're exaggerating. It's just cramps. Meanwhile, their condition worsens. So if your period pain feels extreme, if it interferes with your life, that's not something to ignore. Test tube tests to detect. Pelvic ultrasound, MRI, laparoscopy, definitive diagnosis, shield prevention, management, early medical consultation, hormonal therapy, pain management, lifestyle support. Pain is not something to normalize. Speak up, follow the lab plug. The paralysis that comes suddenly, Guillain-Barre syndrome. One day you're walking, the next day, your legs won't move. This one is rare, but very real. And when it happens, it's terrifying. Imagine this. You wake up feeling normal. Maybe you recently had a mild infection, nothing serious. Then suddenly, you feel weakness in your legs. At first, it's small. You think maybe you're tired. But it keeps getting worse. Walking becomes difficult, then almost impossible. This is Guillain-Barre syndrome, GBS. A condition where your immune system attacks your nerves. Yes, the same immune system meant to protect you. It damages the nerves that control movement. And the weakness starts spreading, from your legs, to your arms, to your face. In severe cases, it can affect breathing. Now imagine how fast this changes your life. From independence, to needing help to move. And the scariest part, it can happen within days. But here's the hopeful part, most people recover, with proper treatment. But early recognition is critical. Test tube tests to detect. Nerve conduction studies, lumbar puncture, CSF analysis, neurological examination. Shield prevention, management, early hospital care, immunotherapy, physical rehabilitation. Sudden weakness is never normal. Act fast. Follow the lab plug.